Hey everyone, Justin Holland here with the Mad Insurance Show, making a difference in insurance. We've got another action-packed show for you today. Got to go over plenty of articles and news and some scenarios of what we've encountered just this week alone in our industry and business. And I want to talk about that on the show today. And hopefully, as always, we provide some value for the listeners that are actually listening to us on a Saturday evening here on KTSA. While you're driving around or scooting around town today. Fiesta weekend, by the way. So be careful out there on Fiesta. Hopefully the rain will not come back and ruin that for you. But we are very excited about this show today. I'm going to bring up some pretty cool stuff, I think, and that will resonate with everybody that's listening. As always, I want to do a reminder that if you are on social media or basically on YouTube, I got to plug our YouTube show. It is the Mad Insurance Show on YouTube. And where you can go for that is go to www.youtube.com/@Mad Insurance Show. So I think I'm up to like 5 subscribers now. So we're really blazing that and making some progress. But, I don't want you to feel sorry for me, but hey, get out there and like and follow us online. You'll see all the past episodes. We're going to be putting clips as well. And you'll get notified when we have new shows that come up on that as well. But the Mad Insurance Show, just as a reminder, if this is your first time basically chiming in or listening to the show, I created the show just to go over everything insurance. I think a lot of people just are not aware of what's going on in the industry. And this show, we're talking everything from health insurance to life insurance to retirement, Social Security analysis, and even auto and home insurance and commercial lines. I try to have guests join us on the show every couple weeks. And when that works out, hopefully we'll have a guest next week or the week after. And let's see what we can do to help you guys out. But I can't thank you enough for listening. And let's kind of dive in to who's backing the show. And that's going to be Texas State Insurance Services. And that's one of our agencies. Texas State Insurance Services is really going to focus on individual health, Medicare for seniors, as well as health coverage options where maybe Affordable Care Act plans are just too expensive, or even group insurance can be too expensive. We also help out with employee benefits, as well as travel insurance, dental and vision plans. So Texas State Insurance Services, just think of that strictly health insurance, employee benefits. If you're a small, medium, or large size business and you need help assessing your current benefits plan, or you want to engage us to help see if it's time to start offering a plan to your valued employees, we'd love to talk to you. Our phone number at Texas State Insurance Services is 210-880-5316. The website is txstateinsurance.com. You can fill out our contact form and reach out to us. I'll have Lydia in the office probably reach out to you, and we'll set up a time where we can visit and review whether it's individual, Medicare, or your employee benefits. And I'm talking employee benefits down to 1 or 2 people, if need be, or 2,000 plus. We have the ability and the channel partnerships to basically help you out everywhere there on the benefits, no matter the size. Palmetto Life Group is our other agency that I created to focus on life insurance, long-term care insurance, Social Security analysis as it relates to retirement, as well as some retirement as well. And then we're real excited. I keep on bringing this up. We're finally getting some traction on the auto, home, and commercial lines of coverage. And we are saving some people some money on their auto and home insurance. Just last week, we helped a lady convert, and collectively, she saved about $600 a year on her auto. And we're saving her almost another $700 on her homeowner's insurance. Same coverage. We didn't tweak anything. It was a lateral move on the coverage. It just made sense to go to another carrier for them once we shopped it. I think we shopped it like with 8 to 10 carriers. And some of them were nowhere in the ballpark where we need to be, but some of them were like, hey, we'll write this business and we'd like to have them as a client. So if you've got auto and home insurance that you might be happy with, or you just want us to help shop and take a look at, we'd love to talk to you on that, as well as life insurance, living benefits, long-term care planning, Had a long conversation with a client yesterday about long-term care. Actually, it was a potential client as a dental office here that needed our help on employee benefits. And we went down that rabbit hole of long-term care. They just didn't realize the exposure that was there. But if that is something you need help with Palmetto Life Group, you can reach us at 877-357-5316, or you can go to palmettolifegroup.com. So I've kicked off the show for this episode, basically, reminding everybody why we have the show, what it entails, the two agencies that we have to help you out. By the way, we're located in San Antonio, but we have a location in McAllen. We've got 4 locations in San Antonio where we can meet you at. And then the Rio Grande Valley, we have a pretty good presence down there, and we can meet you anywhere down there, as well as Laredo and South Texas and Corpus Christi. We're coming. So, just keep us in mind on everything that you might need. I might not bring up a topic that you are interested in, but you do have something that you want to ask us about. Give us a call at one of the agencies there, and we'd love to help you out. I want to kick off another segment of the show right now on talking about myself, and I've got some great articles. We got some news we want to bring up, but I had somebody a few days ago, a client and friend, and they were like, "What's your story?" And we've all got elevator pitches and everything about us and our company and what we do. But he was specific to me. He was like, "Hey, what is your story, Justin? On, kind of some background there so I have an understanding of that." And nobody's asked me that. And that was, I'm sure somebody maybe has, but I mean, not, it's been a while. So I kind of want to take a few minutes and just discuss me so you can size me up in our agency on what we're trying to do. So I got in this industry and business around 2012, 2013, right on the heels of the Affordable Care Act. Okay. The Obamacare, Affordable Care Act, whatever you want to call it, it was the biggest piece of legislation at the time. I was actually in another industry and still working in another industry in the building materials industry for years. I'd been doing that for a while. And I had that entrepreneur bug and that spirit. I was like, you know what? I need to find something that I can do on the side and see if we can scale and grow that. At the time, my uncle had a CPA firm, still has it actually, and got dialed in on the life insurance side of the business and the retirement. But I couldn't help not look at the Affordable Care Act and the health insurance side of that business. And I'm so glad I did. Actually, I'm remembering right now, my father is like, "Man, you need to really look at the health insurance too." I was like, "Nah, I want to focus on the life and the retirement plans and all that." Well, um, it was a challenge at first, many challenges with the Affordable Care Act. My wife would be watching me basically be on the phone for hours at a time, helping clients navigate absolute chaos on the Affordable Care Act websites and trying to get authorized and get credits and get affordable coverage. It was really tough. I was starting out doing tabletops in the industry, HEBs, okay, even some pharmacies, local, either CVS or Walgreens, and really didn't have 2 nickels to rub together. And my wife was doing a great job on helping me, supporting me on getting this business up and running because it's tough. It is really tough to stick the landing and last in this industry. And I want y'all to know that we appreciate every referral you send over to us. We appreciate every opportunity that we can have to help you get in to affordable coverage or better coverage. And listen, sometimes we fall short. Sometimes we'll drop the ball or we get overwhelmed. This fall, there were some people that were frustrated with me and in our insurance agency just because we had so much chaos. There was so much noise out there in the industry, and there was so much disruption. It caught us off guard. We've put some really cool things in place to help turn that corner. But I think that's important for you to know as a potential client of ours or an existing client of ours. We value it. What drives me and keeps me in this industry and business, and specifically what we're doing with Texas State Insurance Services and Palmetto Life Group, is who we're helping. We could probably focus on another segment more in this business and maybe bring in more revenue. But I had this conversation yesterday with a person at an event, and we're helping a lot of people. We're those phone calls, those messages, those voicemails I get from people, or just talking to our clients say, "Hey, Justin, I don't know how I would have been able to not get through this situation with you helping us navigate that." That charges me up. And we're facing as an agency and other brokers like myself in this industry on not getting compensated on a lot of work that we do out there. But we like what we do. We're helping a lot of people and we'll figure it out. That's our job, but at the same time, just know that you're not going to find somebody that's going to try to outwork more, um, outlast, out improve, and just be the best that we can and play the long game in this business and industry. I hope we can be your agent and agency of choice for y'all's lifetime, for children and family members' lifetimes as well. So just it's important for me to let everybody know that, and that's my story. Or just as it relates to this industry and business, it's been a long road. We've learned a lot, had a lot of challenges. We've helped a lot of good people out there that were skeptic on us being able to help them out with a solution. I mean, I brought this up on a prior show a few weeks ago. We had a client, and they were facing a serious medical situation for a spouse, and the health sharing plan they had, the ministry plan, was just not cutting it. And we were able to find a solution to be able to get that family member covered on a true PPO health insurance plan. Okay. And the wife called me back and finally said, Justin, I don't know how you did it. Everybody else didn't have the solution, and you came in and really helped us when we didn't know where else to go. So if you're in that situation where you're like, hey, I need to make sure I'm looking at every option that's available to us, give us a call. And if it's specific to health insurance, or employee benefits, remember 210-880-5316, or go to txstateinsurance.com, or Google just Texas State Insurance Services, Justin Holland. You'll find me online. If it's more so where you need help on the individual auto, home, life insurance, commercial lines, maybe you need to do a social security analysis. Maybe you're in your early 60s and you want to make sure you've got a good game plan for that. Or you're still working and you still need to do an analysis and see, hey, is it time to start drawing Social Security? We will help you with that. We will take a look at those options and see what will work best for you. And Palmetto Life Group's number again is 877-357-5316, or you can always go to palmettolifegroup.com. But I thanks for putting up with me on kind of going on that rant about, why I'm in the industry, a little bit of the story. We're really enjoying what we do. We, despite the challenges that we've been having, I know we're providing value. I know we're helping people, and we'd love to help you if you need it. So just reach out to us when you can. So without further ado, let's start talking about some of the articles that I came up and some news that I think everybody needs to keep in mind as far as it relates to health insurance on most of this. But that's been a big topic on every show is health insurance. And I'm you know what, before I forget, I want to bring up something that I think is going to be important. And let me bring this up. This just popped in my head and I didn't have it ready for the show, but I I've been talking to a lot of people about this. There's some stats that we've been seeing, and I think it's going to come to head. So before I start talking on these articles, let's talk about midterm elections. Healthcare costs are going to be top of mind for voters for this coming election. I'm really frustrated as trying to be an industry professional and help people navigate the absolute chaos that we're seeing on healthcare. But some things that I wanted to bring up here is the share of voters who say they are very worried about being able to afford each of the following for themselves and their family. You can't see this because I've got it on my screen, but it basically breaks down, how important healthcare is for most individuals. And 31% of total voters, hey, that healthcare is their priority with that. Okay. Now, when we look at that as far as total voters segmented out to Democrats, Independents, and Republicans, 33% of Democrats are at a high level and in tune of, hey, what's going to happen to healthcare costs? 36% independents and 25% Republicans. And if you need the stats or you want these screenshots that I've got, just reach out to us and we'll send it to you via email or phone or text whenever you need it. A couple other things that I came up when we talk about upcoming elections and the politics of health insurance and healthcare. Over time, voters have historically trusted Democrats more to address their healthcare cost. The percent of voters who say they trust each of the following on addressing healthcare cost is broken down, and this is a Kaiser Foundation health tracking poll that they put together. Lowering healthcare costs for people like them. You've got there in 2012, 33% of the population felt that the Republican Party was going to help it. 46% of that was Democrat. Now, the last stat on that, as far as reducing healthcare costs or affordability in healthcare, in 2023, that 33% from Republicans went to 39%. From 2012 for the Democratic Party, it was 46%. That went up to 59%. So I'll tell you right now, health insurance and healthcare is going to be top of mind, especially now that we're seeing even more fallout on unaffordable options for health insurance and healthcare. So I want to start having that discussion and topic, and I'm going to start reaching out again to local legislatures that are possibly, going to get elected and get their take on this. I think we need to know where they stand. A lot of times it's gun rights or abortion or overseas politics. Man, we got a problem here and it needs to get addressed as far as healthcare and health insurance. And I think everybody's getting upset enough. I think it's hurting enough where it's going to be a deciding factor this coming fall. Democrats are more trusted than Republicans on healthcare. Opposite is true on the economy. So basically, and I'm not going to go into too far in the weeds, but it shows where healthcare and the economy based 2012, 2016, 2020, and 2024. And the Democrat Party has been there on trying to help curb or assist with healthcare costs. I haven't seen anything on the right side of the aisle. So, and right now, both parties should be attacking this, and they're not. And I'm trying to call it out. And hopefully, we'll start seeing some relief. There's an article here that I'll bring up regarding a disaster in Hawaii, a CMS emergency, and they're giving special election options for individuals. That'll be a whole nother topic. But let's wrap up. Heading into this year's midterm elections, healthcare costs are voters' top economic concern. Okay, I'm going to repeat that. Heading into this year's midterm elections, healthcare costs are voters' top economic concern. It's about time because it's just getting ridiculous out there. The share of voters who say they are very worried about being able to afford each of their following for themselves and their families. And basically, you got healthcare, you got food and groceries, rent and mortgage, monthly utility bills, gasoline, and other transportation costs. And again, this is a article and tracking poll from the Kaiser Foundation, but it's 33% total voters. Healthcare is the priority. Okay. And when we segment that based on party, it's 33% Democrats, 36% independents, and 25% Republicans. But food and groceries comes in at 23%. Rent and mortgage is 22%. Utilities and bills is 21%. Gasoline and transportation, 17%. The highest right now tracking on this poll is health coverage, healthcare, and making that affordable. And I wanted to go on a little rant here, and hopefully we'll start seeing some relief. We'll start seeing some changes because I think one of the articles I'm talking about is the affordability of health insurance. It's just been really tough depending on what insurance you need. So that's me going on a little spiel about the healthcare as it relates to politics and upcoming elections and midterms this fall. So keep an eye on that. And hopefully, we'll have some guests on the show that can give us their take on where they are politically as far as healthcare. And that's really all I'm interested in on talking on the show is that there's other important things as far as political conversations, but I think this should be a top priority, and hopefully it will be. Um, I mentioned a moment ago how Hawaii disaster and CMS emergency response. So, this article just hit. I got an alert on this. CMS this week activated an emergency resource for Hawaii following a public health emergency declaration by Health and Human Services Secretary Robert F. Kennedy Jr. It's tied to the severe storms and flooding and landslides and mudslides that began March 10th. And here's what that means for policyholders. Let's talk about what they're offering. Marketplace Special Enrollment Period, SEP, is allowing displaced Hawaii residents covered through healthcare.gov to have up to 60 days from the end of FEMA incident period to enroll in or change a marketplace plan. Now, I want to dive into this and make sure this is the case, but they are giving Hawaii residents 60 days from the end of the disaster declaration incident period to enroll or change their plans. Now, we've seen this before on the Affordable Care Act where they allow special enrollment options. Okay. I think they need to do it again. I think a lot of people need to have an opportunity to switch plans. We are having to cancel people's plans. People are reaching out to us, Jay, Justin, I just can't afford it. I can't justify this cost. Go ahead and take me off of the plan. And although we say, are you sure? Because I can't get you back on the plan until the end of the year for a January 1st effective date. Are you positive you want to do that? And many of them are saying yes. And we're probably going to reach a third of our business that's basically going to go away because of that. But I think it's important to bring up this emergency declaration. I know it's in Hawaii. It's not even here on the mainland, but it's showing that CMS can very quickly open that up to have special election periods and give people a window to maybe modify the plan they're in, or in this case, actually enroll in a plan because the open enrollment for the marketplace plans ended in January. And I think this is something they need to consider collectively for the United States. Yes, not everything, not everywhere in the United States has an emergency of flooding and landslides and stuff like that, but we are facing a financial emergency. A lot of people are struggling right now, and they need the opportunity to possibly get into a coverage. And they're only going to struggle more if they can't get enrolled in true health insurance plans, and those are only allowed to enroll, in a finite amount of time. So let's see how that goes. They also in this article they talk about Medicare equipment and drug flexibility for Medicare beneficiaries who lost durable medical equipment. That's important. I mean, this was some serious flooding they had over there, and you have people that lost oxygen tanks, wheelchairs, prosthetics due to the flooding, and basically the government's coming and say, "Hey, we're going to help with this." This is this is what I'm talking about. These are solutions to help struggling individuals and Americans figure out how to navigate their health care or get an opportunity to make some modifications and change. Unfortunately, it's a disaster that has to make that happen for these individuals. A little bit further on the article, Medicaid and CHIP Disaster Toolkit, CMS and CHIP Disaster Response Toolkit is basically something they have online for the Hawaii residents for the more vulnerable populations because of the special emergency. Dialysis emergency response, the network activated 17 KCER programs for kidney patients. I mean, that is all hands on deck that they're doing for Hawaii, which they should. HIPAA flexibility on hospitals that declare disaster protocols can receive temporary HIPAA enforcement relief for up to 72 hours, easing the communications and protocols. So the takeaway on this article that I wanted to dive into is our first article. Um, Hawaii faced this disaster. CMS and Health and Human Services came in and said, "Hey, we're gonna help. We're gonna create some flexibility, and we're gonna open up an enrollment opportunities based on what I'm seeing here for people that didn't have health insurance and are facing medical emergency with this disaster to get enrolled." And if they can do this like what they're doing here in April for Hawaii, and that they've done collectively for the entire United States in prior years, I think this needs to be considered this year. I could be wrong. Sure, a lot of people say, "Oh, we need to fix this and before we can open things back up." Um, I'm seeing many, many people here locally and hearing it around the country on where people are just their disaster is their financial situation. They didn't need a mudslide or bad weather, inclement weather to come in and disrupt it. They're getting disrupted right now. And with these, i- you know, crazy healthcare costs or health insurance costs, and giving everybody an opportunity to maybe pivot and change plans or just get enrolled themselves because whatever reason, they missed a payment or they missed an enrollment deadline or didn't get information back to the marketplace in time, I think it needs to be opened up. And hopefully that'll resonate. Not sure if that'll get to the right people, but I think that's important to consider, especially seeing what they're doing for Hawaii over there as well. So, just a reminder you're listening to the Mad Insurance Show, making a difference in insurance. I'm your host, Justin Holland, with Texas State Insurance Services and Palmetto Life Group. Just remember, this show is just talking about everything insurance. If you're just tuning in or getting into the podcast, we're going to talk everything insurance, all types of scenarios in the industry. A lot of articles like what I'm bringing up today are things that I address and just make sure everybody's aware and provide some value on that. But Texas State Insurance Services is who you'll want to contact if you need help with individual health insurance, Medicare, employee benefits, travel insurance, dental and vision, stuff like that. And even health coverage alternatives as well, where maybe what you've got is just too expensive. Give us a call at 210-880-5316. Palmetto Life Group is our agency, remember, for life insurance, long-term care, Social Security analysis as it relates to retirement, as well as auto, home, and commercial lines of business. That phone number is 877-357-5316. And you can visit us online at palmettolifegroup.com. So if you got questions on something that we might be missing on the show today for you, give us a call. We'd love to help you out and take a look and see where we can help you with some solutions. So let's keep on diving in. Segment 3 that I created was Social Security's 2032 countdown. What happens if nothing changes? So this was an article that I came across, and I was like, you know what? Let's talk about that. I'm a registered Social Security analyst. So what's nice about, the value we bring to our clients is we are an RSSA, registered Social Security analyst. We have software to be able to help you analyze and really heat map out where you should possibly take your retirement, where you should possibly wait. Maybe it makes sense not to wait, how that relates to your spouse and their survivorship benefit plan. We got some really slick tools to be able to help you out with that. And I think a lot of people are missing the boat on where Social Security can help them. And hopefully, you reach out to us and we can help you out with a Social Security analysis. But this was a Fortune magazine article on their website on what happens if nothing's done to fix Social Security by 2032. So Social Security is not going bankrupt. Let's get that clear, but it is heading toward a major funding cliff, and the clock is ticking. And some of our listeners need to understand what to expect or where we're at like that. And I've put together some bullet points to be able to review so we can talk about this interesting article we came up against. The Social Security OASI Trust Fund is now projected to be depleted by early 2032, based on the latest Congressional Budget Office projections. If Congress takes no action, Social Security would then pay benefits only from incoming payroll tax revenue, triggering an automatic and broad benefit reduction estimated to be between 23 and 28%. So I with this first part of the article or the bullet points that I put together, Social Security is still going to be there. It's a pay as you earn system or pay as you go system, but I just don't know if we're going to have the full Social Security retirement available like what other generations or individuals taking on their Social Security right now are enjoying or have access to. The real world impact of a 28% cut at a current 2026 benefit level is basically going to look as average retired workers' monthly benefit drops from roughly $2,071 to approximately $1,491, a loss of nearly $7,000 per year. So this is big. This is something that needs to be addressed and we need to be concerned about. And I just talked about having legislatures come on the show to talk about healthcare as it relates to the midterm elections. This is something that we need to be prepared for on the long term. Okay. As we rotate congressmen and senators and officials, we need to make sure everybody's focused on a long term path as well. Because if we're talking a $7,000 drop in Social Security benefits for individuals, while everything else is increasing in cost, we have a huge problem. Okay, we got two trains getting ready to collide, so to speak. The average retired couple monthly income drops from 3208 to 2310, more than $10,700 lost annually or collectively for a couple. So if we can't figure this out and stick the landing on protecting, the outcome of this Social Security issue in 2032, which will be here before we know it, we got some problems. The broader impact ripple, a cut this size would put billions of local spending, slow down the GDP potentially, prompt Federal Reserve rate cuts, and push many retirees back into the workforce. Okay. Um, Pretty bleak situation there. As people are retiring, they're really not wanting to go back to the workforce. You look at 2008 when a lot of people just lost everything, homes, their financial security, their retirement, and a lot of people couldn't retire when they had planned or had to come out of retirement because of that. This looks like if this could be a major problem and just compound on what we're facing right now here in 2026. The 1983 president, bipartisan reforms under Reagan saved the program back then. So back in 83, I was like 4 or 5 years old at the time. Bipartisan reforms under the Reagan administration saved the program back then and required both tax increases and benefit adjustments. So lawmakers may be waiting, have been waiting a long time to try to update and take a look at what we can do to help fix Social Security. The one big beautiful bill accelerated the timeline by cutting tax revenue Social Security depends on, moving the depletion date up roughly 1 year. And I mean, that's what their stats are telling us. Who knows if it could happen sooner? So it's important to just stay on top of this. More than anything, I just wanted to discuss, I would not panic about this, but this needs to be addressed by Congress and they need to act on it sooner than later. So if you got a political contact or you got an ear into or your congressional office, this is something you need to ask them about. Say, hey, by the way, did you know about this shortfall? And we see it on the news all the time about Social Security not being there or being disrupted. I think it's going to be more prevalent and more obvious more than ever on what could really happen and who could be hurt in this. Retirees or near retirees should factor in the potential benefit reductions into their financial planning. Okay? If they don't fix this, if Washington doesn't get this fixed, and by the time we hit 2032, you're already retired and you've budgeted what you can, those 7,000 or $10,700 losses annually in your benefit are going to hurt. And if you're not prepared for that, it could be a big problem. So I'm saying not to panic, but you want to make sure you visit with us. We take a look at your Social Security analysis report so you can prepare. And that goes for people in their late 50s, early 60s that aren't necessarily drawing Social Security yet, as well as those who continue working that might be, hey, you know what, Justin, I did take a look at the snapshot that they send me in the mail. I'm going to hold off till full retirement age and then start taking my benefits. That could be the scenario as well. But I had a lot of clients, they're like, listen, I'm going to take whatever I can for Social Security now because I'm just not optimistic, so to speak, on if it's going to be there later. And with these stats in this article, that is a that is a valid concern that they need to keep up with. Consider how your overall retirement income picture looks like. You should not be depending solely on Social Security if at all possible. Try to have some income producing assets, some insurance products that could come into play. Excuse me, is such as long-term care planning, life insurance in some cases that can provide a buffer, for that retirement strategy along with Social Security. Because if Social Security takes this hit, we got a real problem, and hopefully that gets addressed. But I'll kind of segue into Palmetto Life Group because we're on the topic of Social Security. Remember, Social Security analysis. I am a registered Social Security analyst, so our agency can actually help you really navigate and take a snapshot. And like I mentioned a moment ago, heat map what is the best opportunity or strategy for your Social Security. We'd love to help you out with that and kind of give you a full picture on that because Palmetto Life Group, we pride ourselves on trying to make sure we separate ourselves from other insurance agents and professionals in the industry and business to where that value out of that Social Security analysis, I got to tell you, it's priceless. So it's been very helpful on a lot of our Medicare clients and individual health insurance clients, as well as owners of businesses, sole proprietors, and entrepreneurs. They need to have a handle on where they stand on Social Security. Absolutely, based on the article that we just discussed and talked about the concerns for 2032. If you need help on that, reach out to Palmetto Life Group at 877-357-5316, or you can visit us online at palmettolifegroup.com, complete the contact form, and we'll help you out as soon as you reach out to us. So another article that I want to bring up is going to be regarding the ACA subsidy fallout for 30,000 Idahoans that are losing coverage in the national picture. So this is becoming a weekly theme, everyone. I have been talking about, Pennsylvanians, New Yorkans, now Ohioans or Idahoans regarding the fallout and the disruption that we're seeing on affordable health insurance. And this article came out to me. It was through the Chicago Tribune, and it hit the news on April 23rd, so a few days ago, or yesterday, actually. After insurance subsidies end, 30,000 Idahoans will be uninsured. Okay. Again, it's not Texas. It's not here the demographic that we're serving the majority of our clients for, but we need to keep an eye on what's going on in other states. And I'm just waiting for the article and stats on what Texas looks like. And those might already be out there. I'm going to do a little digging, hopefully for the next show, so we can understand that. But as I mentioned earlier, I mean, we're on track to lose a third of our clients on the individual Affordable Care Act plans, strictly because of cost and that middle class that got crushed. And not only them, some of the other individuals just straight out cannot afford even what is deemed affordable premiums for their health insurance. So the Idaho as a national barometer, when Congress failed to extend the enhanced ACA premium tax credits, Idaho became an early warning sign. A new report from Your Health Idaho found that approximately 30,000 people who had insurance through the state insurance exchange are likely uninsured this year. 30,000 people. Okay. There's got to be individuals in that 30,000 or family members in that 30,000 people that have a cancer diagnosis, that have a chronic illness, maybe a long-term care situation that could possibly address somewhat in their health insurance, and they're uninsured. Okay. That is a problem, and that should be a major concern. And this right here, this article ties into my article or talking about, it wasn't even an article, it was talking about the stats on healthcare being top of mind for the upcoming election. Um, this is showing that regarding these stats, about 24,400 people disenrolled from the exchange plans since the open enrollment to compared to 16,000 plan cancellations the same period that last year. In Idaho, the enhanced credits had been reducing monthly premiums by an average of $407. That's big savings there. With them gone, 87% of the Idaho Exchange enrollees through the marketplace were receiving those tax credits. Now face sharply higher costs. I've talked about this for months on multiple shows on what we've seen on those increases in cost for health insurance. Um, this article was actually drafted by Terry Savage, and she goes, Terry, and this one segment that I pulled from it, Terry Savage's health insurance sinkhole. So the financial columnist warns that the removal of the ACA subsidies is no longer just a prediction, it's how the reality is hitting households across America. I totally 100% agree with that, especially what we're seeing here in the San Antonio metro area and South Texas, collectively, where the majority of our clients are located. Even members of Congress are now required to buy coverage through the Obamacare exchanges under the Affordable Care Act. The subsidy income threshold in 2026 is up to $132,000 for a family of four. Above that, there is no subsidy. $132,000, you think, hey, that can go a long way. Well, when you have two incomes that are pulling in 132,000, you're getting taxed on that income. You could have state taxes on that as well, and you're trying to cover the cost of food for the family, gas, childcare. It dries up very quickly. Especially, I mean, I was talking about this a few days ago with somebody. I got shocked. I was in Austin visiting my daughter up there, and the gas tank bill, I was pretty low, so I had to fill up completely. It was over $75, and I was like, "Man, what is this right?" Because I think I'd spend in like 40, maybe $50. I was like, "Man, that seems high for regular unleaded gasoline." Um, People are really struggling, and these healthcare costs are just compounding that, on how they're personally feeling and the pinch of rising premiums. Let's see if we can get some of these legislators on the show and see if they've got a game plan and hold them accountable and say, "Hey, listen, are you going to try to fix this? Are you going to work with other members of Congress and legislatures to try to help repair this and turn this, rearranging the deck chairs of the Titanic, so to speak, of what's going on?" I'll wrap up with this Savage's point. When the people were writing the laws experienced the same cost than ordinary Americans, maybe the political will to fix it increases. So let's talk about that when I think we need to kind of process that. Basically, Terry Savage is saying the fact that the members of Congress are now required to buy their coverage through the Obamacare exchanges under the Affordable Care Act, you know, maybe with them facing some challenges off of that, it will say, "Oh, okay, this is a problem. Maybe we do need to fix this. Maybe we." And listen, I think there's some legislatures that get it, they understand it, they have family members, friends, colleagues, clients that have been enduring this. Hopefully, this might move the needle a little bit as well. But the fact that this is playing out in Idaho as well as the other states that I brought up in prior shows, it's nationally. It's no question. It's affecting Texans here and our valued clients because we're seeing it firsthand. If you're buying coverage on the individual marketplace and relying on subsidies or recently lost them, it's time to review all your options. And I'll wrap up this article with the fact that Texas State Insurance Services, we have some solutions. The Affordable Care Act plan that you might have had or lost might not have been the best option. We can look at health insurance options where you can get that PPO network. Believe it or not, it's going to cost more, but it could be the solution that you're looking for. We have health coverage options. I've brought this up before as well, the difference between health insurance and health coverage. But in some cases, for those individuals that are relatively healthy, but know they need to have something in place, God forbid a medical emergency comes up, we've got those options to be able to help you out with. And you can reach out to us at Texas State Insurance Services. The phone number is 210-880-5316, or visit us online at txstateinsurance.com and complete our contact form, or just give us a call with the number that's on the website. And like I mentioned, Lydia or Erica will take that call and we'll help schedule an appointment. And you're going to be talking to me. I have my hand on every single policy, every single client that we service. And that goes from a individual Medicare client or individual family client for Affordable Care Act plans to a two-person benefits group to 2,000 employees. I am involved. I am there. We're striving to help you and hopefully have you as a long-term client. So hopefully that if that resonates with you, man, I'm here to help you. And let's see what we can do to take on all this chaos that we've got, specifically right now in health insurance. So, another article that I came across with the USA Today, April 24th, which was today, actually, this article dropped. I just pulled this up this morning. Medical bills insured by Americans still fear debt. A major new study reveals a sobering truth. Having health insurance does not protect you from medical debt. And here's what the research shows. So, and we're talking medical debt on serious situations that come up. I'm not talking about that occasional, you go to an ER center and it's not in a hospital network with your coverage and they blast you with an $8,000 bill. Although that's a problem. A lot of it is significant health related cost or chronic situations. But in 2026, the average ACA Marketplace plan, a silver plan or a silver level plan, carries a deductible of $5,304. A bronze plan average is $7,186. So we got a little over 5,000, a little over $7,000. That deductible, that's what you're responsible for. Once you hit that deductible is when the insurance company, on top of paying your premiums, is going to cover, the significant medical costs that you've endured. So let's just a real quick example. Let's say you got a major medical situation that came up and it's $80,000, $100,000. Let's just call it that. If you're on that bronze plan, you're going to be responsible for $7,186 of that 80 or $100,000 exposure. And then the insurance company is going to take that up. The Health Insurance Affairs study found that 18 months after a traumatic injury, let's say a car accident, a fall, a sudden medical event, the share of patients' medical debt in collections rose 24% relative to the pre-injury. 24%. Okay, that's a problem. Patients on Medicare and Medicaid far better outcomes though. Minimal increases in medical debt and bankruptcy compared to those with private insurance. And let's call private insurance maybe an employer-sponsored plan that you're on through a job, or maybe you're in an individual health insurance plan that you've got through the marketplace. According to the Kaiser Foundation, which got linked to this USA Today article, about half of all U.S. adults say they could not pay an unexpected medical bill of just $500 out of pocket. So, half of the United States adults that are on a health insurance plan or might not be on a health insurance plan could not pay an unexpected medical bill of just $500 out of pocket. And I'm bringing up the fact that the silver plan deductibles of exposure start out around $5,300 to $7,100 or more for the bronze plans. Again, this has been a theme for me on the article, not on these articles, but something's got to give. Our legislature's got to act, and hopefully they will listen and kind of bring in some countermeasures and make this an emergency. I think this is, look at these stats of an estimated 100 million Americans currently carry some form of medical debt. 100 million Americans carry some time of form of a medical debt. That's just compounding on top of higher premiums, not having coverage. Why this matters is basically, having a card in your wallet does not mean you are protected. Just because the fact you can put it on a credit card or not even that, your insurance card, high deductible plans are going to leave you huge exposure that you need to be cognizant of. And you need to make sure you visit with an agent broker like ourselves and say, hey, Justin, what does my exposure look like? I've got clients that can easily take care of their deductibles and maximum limits, and great, they're in a position to be able to do that. But the reality is, a lot of people are not. And we want to help with solutions to where maybe, hey, we get you on this insurance plan, but there's another other plan that can help counter that deductible or maximum limit. God forbid you need it. And a lot of those premiums are affordable. We need to do a better job of that, of making sure we analyze those options for our clients. And that's why I'm glad we're bringing it up on today's show. Supplemental insurance products, I just brought this up, like hospital indemnity plans, critical illness policies, and cancer coverage exist especially to fill that gap. We have access to multiple carriers. Now, granted, there could be underwriting and situations where you got to get approved on that, but let's at least see, let's exhaust that as an option. This is exactly why we review full clients, do a complete review. We do an assessment. I'll have people that reach out to me on Medicare, and they're like, Justin, I don't want a Medicare Advantage plan. I want a supplement. Just focus on that. We're like, great. Totally excited that you know exactly what you're looking at. You've done some research, and we're going to help you with that enrollment, but we're also going to do a complete review. We're not going to not show Medicare Advantage plans in conjunction with all the supplement options they've got for the two options that they have. Not only that, you need to know how that relates or correlates with your group insurance plan, okay? On your employee benefits plan. That's a huge situation where there can be a disruption on not knowing the difference between the two and maybe getting out of a plan prematurely. We'll have clients that will say, hey, you're in a good spot right now. Just stay in a holding pattern. We'll be here on the bench to help you out if anything changes. That reminds me, I met with a client yesterday, and the owner of the dental practice is Medicare eligible, and he had access to a Cobra benefit plan that's exiting, and he was like, "Hey, do I need to get on this small group plan, Justin, that you're putting, in place for our valued employees?" I was like, "Not necessarily. Let's see what it looks like with a review on Medicare and keeping your Medicare A and B and having a supplement plan medically that'll pick up everything except for a $289 deductible. I think that's what it is. I'll double check that. I can never keep up with all the deductibles and maximums without it in front of me. But and then he'd have a standalone prescription drug plan. And if he's not taking any high tier medications, then we might want to have him off of the risk of the group benefits plan and just go full fledged Medicare. Where I'm going with this is we're going to do a complete review. We're going to look at that scenario. We're going to look at how the family glitch relates to the group benefits plan that they're wanting to offer, because it could affect a tax credit that some of the employees might qualify for still, even though many lost it on their individual health insurance that they could possibly have. And we just got to figure out, okay, do we just park the family members over here and have these employees join the plan or make that decision if they want to join the employee benefits plan as well? But man, we are having solid gold discussions today, or I'm able to talk about some really important things that are going on. But medical debt for uninsured Americans or underinsured Americans. I mean, where's that stat? Let me pull it. An estimated 100 million Americans currently carry some type of or form of medical debt. Okay. That's a sobering detail and stat on this article that I'm bringing up here. I think I've got time for one quick notice, and then we'll wrap up the show. So I got an alert from Blue Cross Blue Shield, or not an alert, but a reminder, the fact that CMS and Medicaid are navigating or helping individuals navigate between Medicaid and marketplace plans. This is important. Let's just talk about that quickly. If you are on Medicaid for whatever reason, or maybe you have a family member or a loved one or an employee, and maybe they might lose that Medicaid and they need to get onto a marketplace plan, okay? Or they're on a marketplace plan and they should qualify for Medicaid or do qualify for Medicaid, they need to be on that. You want to make sure that you navigate that. If that is in question, give us a call and we'll help you do a quick review on that. Not to go into the weeds on this, but just, if you recently lost Medicaid coverage or you're receiving an ACA Marketplace plan and subsidy and your income situation changed, you might need to say, "Hey, I might need to get back onto Medicaid," okay? And still maybe have some of the family members stay on the ACA plan if that occurs. Think this might become more prevalent later this year, but that's if that's y'all's situation, let us know. One more thing, and then I'm wrapping up the show. I promise. Medigap, Medicare Supplement insurance, is hitting beneficiaries with premium increases unlike anything seen in decades. So we're seeing probably another round of double-digit increases on your Medicare medical supplements, whether it's Plan F or the very popular Plan G or high deductible Gs. We are seeing, we're starting to get the notifications from our carriers that we have enrolled on these plans on what to expect for increases. So, real quick, just if you got a Medicare medical supplement plan, you might want to reach out to us for a review on that because we're anticipating more double digit increases than what we've seen over 5 years ago. So I'll wrap up with that. I can't thank you enough for joining us here on the Mad Insurance Show. Again, I'm your host, Justin Holland with Texas State Insurance Services and Palmetto Life Group. I'll give you the Texas State Insurance's phone number just in case anything that I said resonated or discussed on the show and you have more questions on it. You can reach us at 210-880-5316 or visit us online at txstateinsurance.com. Make sure, just as a reminder, follow us and like us on our YouTube channel, on the Mad Insurance Show on YouTube. And reminder on that is going to be YouTube, www.youtube.com/@Mad Insurance Show. Thanks again, everybody, for joining us. We'll talk to you again next week. Take care, everybody.